Question 1. The nurse is preparing to teach a prenatal class about fetal circulation. Which statements would be included in the teaching plan? Select all that apply. 1. The ductus arteriosus allows blood to bypass the fetal lungs. 2. One vein carries oxygenated blood from the placenta to the fetus. 3. The normal fetal heartbeat range is 160 to 180 beats per minute during pregnancy. 4. Two arteries carry deoxygenated blood and waste products away from the fetus to the placenta. 5. Two veins carry blood that is high in carbon dioxide and other waste products away from the fetus to the placenta. Explanation. Question 1. Rationale. The ductus arteriosus is a unique fetal circulation structure that allows blood to bypass the non-functioning fetal lungs. Oxygenated blood is transported to the fetus by one umbilical vein. The normal fetal heartbeat range is considered to be 110 to 160 beats per minute. Two arteries carry deoxygenated blood and waste products from the fetus, and one umbilical vein carries oxygenated blood and provides oxygen and nutrients to the fetus. Blood pumped by the embryo's heart leaves the embryo through two umbilical arteries. Test-taking strategy. Focus on the subject, fetal circulation. Recall that 3 umbilical vessels are within the umbilical cord, 2 arteries and 1 vein, and that the vein carries oxygenated blood and the arteries carry deoxygenated blood. Also, recalling the normal fetal heartbeat will assist in answering correctly. Question 2. The nursing instructor teaches a group of students about fetal circulation and then asks a student to describe fetal circulation, specifically the ductus venosus. Which statement by the student indicates an understanding of the ductus venosus? 1. IT connects the pulmonary artery to the aorta. 2. IT is an opening between the right and left atria. 3. IT connects the umbilical vein to the inferior vena cava. 4. IT connects the umbilical artery to the inferior vena cava. Explanation. Question 2. Rationale. The ductus venosus connects the umbilical vein to the inferior vena cava. The foramen ovale is a temporary opening between the right and left atria. The ductus arteriosus joins the aorta and the pulmonary artery. Test-taking strategy. Focus on the subject, an understanding of the description of the ductus venosus. Use knowledge of fetal circulation to assist in answering. Also note the relationship of the word venosus in the question and vein in the correct option. Question 3. A pregnant client tells the clinic nurse that they want to know the sex of the baby as soon as it can be determined. The nurse plans to inform the client that they will be able to find out the sex at 16 weeks gestation because of which factor? 1. The appearance of the fetal external genitalia. 2. The beginning of differentiation in the fetal groin. 3. The fetal testes are descended into the scrotal sac. 4. The internal differences in different genders become apparent. Explanation. Question 3. Rationale. Between weeks 16 and 20, the external genitalia of the fetus have developed to such a degree that the sex of the fetus can be determined visually. Differentiation of the external genitalia occurs at the end of the 9th week. Testes begin to descend into the scrotal sac at the end of the 38th week. Internal differences in the genders occur at the end of the 7th week. Test-taking strategy. Focus on the subject, when the sex of the fetus can be determined. Use knowledge about fetal growth and development. Remember that the sex of the fetus can be recognizable visually on ultrasound by the appearance of the external genitalia between gestational weeks 16 and 20. Question 4. The nurse is performing an assessment on a client who is at 38 weeks gestation and notes that the fetal heart rate, FHR, is 174 beats per minute. On the basis of this finding, what is the priority nursing action? 1. Document the finding. 2. Notify the obstetrician, OB. 3. Check the mother's heart rate. 4. Tell the client that the fetal heart rate is normal. Explanation. Question 4. Rationale. The FHR depends on gestational age and ranges from 160 to 170 beats per minute in the first trimester but slows with fetal growth to 110 to 160 beats per minute. If the FHR is less than 110 beats per minute or more than 160 beats per minute with the uterus at rest, the fetus may be in distress. Because the FHR is increased from the reference range, the nurse would notify the OB. Options 3 and 4 are inappropriate actions based on the information in the question. Although the nurse documents the findings, based on the information in the question, the OB needs to be notified. Test-taking strategy. Focus on the data in the question and note the strategic word, priority. Then, note if an abnormality exists. Also note the FHR and that the client is at 38 weeks of gestation. Remember that the normal FHR is 110 to 160 beats per minute. Question 5. The nurse is conducting a prenatal class on the reproductive system. When a client in the class asks why the fertilized ovum stays in the fallopian tube for 3 days, what is the nurse's best response? 1. IT promotes the fertilized ovum's chances of survival. 2. IT promotes the fertilized ovum's exposure to estrogen and progesterone. 3. IT promotes the fertilized ovum's normal implantation in the top portion of the uterus. 4. IT promotes the fertilized ovum's exposure to luteinizing hormone and follicle-stimulating hormone. Explanation. Question 5. Rationale. The tubal isthmus remains contracted until 3 days after conception to allow the fertilized ovum to develop within the tube. This initial growth of the fertilized ovum promotes its normal implantation in the fundal portion of the uterine corpus. Estrogen is a hormone produced by the ovarian follicles, corpus luteum, adrenal cortex, and placenta. During pregnancy, progesterone is a hormone secreted by the corpus luteum of the ovary, adrenal glands, and placenta during pregnancy. Luteinizing hormone and follicle-stimulating hormone are excreted by the anterior pituitary gland. Question 6. The nursing instructor asks a nursing student to explain the characteristics of the amniotic fluid. The student responds correctly by explaining which is characteristics of amniotic fluid. Select all that apply. 1. Allows for fetal movement. 2. Surrounds, cushions, and protects the fetus. 3. Maintains the body temperature of the fetus. 4. Can be used to measure fetal kidney function. 5. Prevents large particles such as bacteria from passing to the fetus. 6. Provides an exchange of nutrients and waste products between the birthing parent and the fetus. Explanation. Question 6. Rationale: the amniotic fluid surrounds, cushions, and protects the fetus. It allows the fetus to move freely and maintains the body temperature of the fetus. In addition, the amniotic fluid contains urine from the fetus and can be used to assess fetal kidney function. The placenta prevents large particles such as bacteria from passing to the fetus and provides an exchange of nutrients and waste products between the birthing parent and the fetus. Test-taking strategy: focus on the subject, the characteristics of amniotic fluid. Visualizing the location of the amniotic fluid will assist in answering this question. Question 7. A couple comes to the family planning clinic and asks about sterilization procedures. Which question by the nurse would determine whether this method of family planning would be most appropriate? 1. Have you ever had surgery? 2. Do you plan to have any other children? 3. Do either of you have diabetes mellitus? 4. Do either of you have problems with high blood pressure? Explanation. Question 7. Rationale: sterilization is a method of contraception for couples who have completed their families. It should be considered a permanent end to fertility, because reversal surgery is not always successful. The nurse would ask the couple about their plans for having children in the future. Options 1, 3, and 4 are unrelated to this procedure. Test-taking strategy: note the strategic words, most appropriate. Focus on the subject, sterilization procedure. Note the relationship between the word sterilization and the words plan to have any other children in the correct option. Question 8. The nurse would plan to make which statement to a pregnant client found to have a gynecoid pelvis? 1. Your type of pelvis has a narrow pubic arch. 2. Your type of pelvis is the most favorable for labor and birth. 3. Your type of pelvis is a wide pelvis, but it has a short diameter. 4. You will need a cesarean section because this type of pelvis is not favorable for a vaginal delivery. Explanation. Question 8. Rationale: a gynecoid pelvis is a normal pelvis and is the most favorable for successful labor and birth. An android pelvis would be unfavorable for labor because of the narrow pelvic planes. An anthropoid pelvis has an outlet that is adequate, with a normal or moderately narrow pubic arch. A platypeloid pelvis, flat pelvis, has a wide transverse diameter, but the anteroposterior diameter is short, making the outlet inadequate. Test-taking strategy: focus on the subject, pelvis type. Recalling that the gynecoid pelvis is the normal pelvis will direct you to the correct option. Question 9. Which purposes of placental functioning would the nurse plan to include in a prenatal class? Select all that apply. 1. It cushions and protects the baby. 2. It maintains the temperature of the baby. 3. It is the way the baby gets food and oxygen. 4. It prevents all antibodies and viruses from passing to the baby. 5. It provides an exchange of nutrients and waste products between the birthing parent and developing fetus. Explanation. Question 9. Rationale: the placenta provides an exchange of oxygen, nutrients, and waste products between the birthing parent and the fetus. The amniotic fluid surrounds, cushions, and protects the fetus and maintains the body temperature of the fetus. Nutrients, medications, antibodies, and viruses can pass through the placenta. Test-taking strategy: focus on the subject, The purpose of the placenta. Remember that the placenta provides oxygen and nutrients. Question 10. A 55-year-old client confides in the nurse about being concerned about sexual function. What is the nurse's best response? 1. How often do you have sexual relations? 2. Please share with me more about your concerns. 3. You are still young and have nothing to be concerned about. 4. You should not have a decline in testosterone until you are in your 80s. Explanation. Question 10. Rationale. The nurse needs to establish trust when discussing sexual relationships. The nurse would open the conversation with broad statements to determine the true nature of the client's concerns. The frequency of intercourse is not a relevant first question to establish trust. Testosterone declines with the aging process. Test-taking strategy. Note the strategic word, best. Determine whether further assessment or validation is needed. In this case, more information is needed to determine the nature of the client's concerns. Keeping these concepts in mind and using therapeutic communication techniques will assist in directing you to the correct option. Question 11. The nurse is providing instructions to a pregnant client who is scheduled for an amniocentesis. What instruction would the nurse provide? 1. Strict bed rest is required after the procedure. 2. Hospitalization is necessary for 24 hours after the procedure. 3. An informed consent needs to be signed before the procedure. 4. A fever is expected after the procedure because of the trauma to the abdomen. Explanation. Question 11. Rationale. Because amniocentesis is an invasive procedure, informed consent needs to be obtained before the procedure. After the procedure, the client is instructed to rest, but may resume light activity after the cramping subsides. The client is instructed to keep the puncture site clean and to report any complications, such as chills, fever, bleeding, leakage of fluid at the needle insertion site, decreased fetal movement, uterine contractions, or cramping. Amniocentesis is an outpatient procedure and may be done in the obstetrician's office or in a special prenatal testing unit. Hospitalization is not necessary after the procedure. Question 12. A pregnant client in the first trimester calls the nurse at a healthcare clinic and reports noticing a thin, colorless vaginal drainage. The nurse would make which statement to the client? 1. Come to the clinic immediately. 2. The vaginal discharge may be bothersome, but is a normal occurrence. 3. Report to the emergency department at the maternity center immediately. 4. Use tampons if the discharge is bothersome, but be sure to change the tampons every 2 hours. Explanation. Question 12. Rationale. Leukorrhea begins during the first trimester. Many clients notice a thin, colorless, or yellow vaginal discharge throughout pregnancy. Some clients become distressed about this condition, but it does not require that the client report to the healthcare clinic or emergency department immediately. If vaginal discharge is profuse, the client may use panty liners, but should not wear tampons because of the risk of infection. If the client uses panty liners, the client needs to change them frequently. Test-taking strategy. Eliminate options 1 and 3 first because they are comparable or alike, indicating that the client requires medical attention. from the remaining options. Recalling that this manifestation is a normal physiological occurrence or that tampons need to be avoided will assist in directing you to the correct option. Question 13. A non-stress test is performed on a client who is pregnant, and the results of the test indicate non-reactive findings. The primary healthcare provider prescribes a contraction stress test, and the results are documented as negative. How would the nurse document this finding? 1. A normal test result. 2. An abnormal test result. 3. A high risk for fetal demise. 4. The need for a cesarean section. Explanation question 13. Rationale. Contraction stress test results may be interpreted as negative, normal, positive, abnormal, or equivocal. A negative test result indicates that no late decelerations occurred in the fetal heart rate, although the fetus was stressed by 3 contractions of at least 40 seconds duration in a 10 minutes period. Options 2, 3, and 4 are incorrect interpretations. Test-taking strategy. Read the options carefully. Note that options 2, 3, and 4 are comparable or alike in that they indicate an abnormal test result finding. Question 14. A rubella titer result of a 1-day postpartum client is less than 1:8, and a rubella virus vaccine is prescribed to be administered before discharge. The nurse provides which information to the client about the vaccine? Select all that apply. 1. Breast/chest feeding needs to be stopped for 3 months. 2. Pregnancy needs to be avoided for 1 to 3 months. 3. The vaccine is administered by the subcutaneous route. 4. Exposure to immunosuppressed individuals needs to be avoided. 5. A hypersensitivity reaction can occur if the client has an allergy to eggs. 6. The area of the injection needs to be covered with a sterile gauze for 1 week. Explanation question 14. Rationale. Rubella vaccine is administered to those who have not had rubella or who are not serologically immune. The vaccine may be administered in the immediate postpartum period to prevent the possibility of contracting rubella in future pregnancies. The live attenuated rubella virus is not communicable in breast milk. Breast/chest feeding does not need to be stopped. The client is counseled not to become pregnant for 1 to 3 months after immunization or is specified by the obstetrician because of a possible risk to a fetus from the live virus vaccine. The client must be using effective birth control at the time of the immunization. The client needs to avoid contact with immunosuppressed individuals because of their low immunity toward live viruses and because the virus is shed in the urine and other body fluid. Question 15. The nurse in a healthcare clinic is instructing a pregnant client how to perform kick counts. Which statement by the client indicates a need for further instruction? 1. I will record the number of movements or kicks. 2. I need to lie rat on my back to perform the procedure. 3. If I count fewer than 10 kicks in a 2-hour period, it could be because my baby is sleeping. 4. I need to place my hands on the largest part of my abdomen and concentrate on the fetal movements to count the kicks. Explanation question 15. Rationale. The client would sit or lie quietly on the side to perform kick counts. Lying flat on the back is not necessary to perform this procedure, can cause discomfort, and presents a risk of vena cava, supine hypotensive syndrome. The client is instructed to place the hands on the largest part of the abdomen and concentrate on the fetal movements. The client records the number of movements felt during a specified time period. If the client feels fewer than 10 movements within a 2-hour period, it could be because the baby is sleeping. Test-taking strategy. Note the strategic words, need for further instruction. These words indicate a negative event query and ask you to select an option that is an incorrect statement. If you are unfamiliar with this procedure, recalling that the risk of vena cava, supine hypotensive syndrome exists when the client lies on the back will direct you to the correct option. Question 16. The nurse is performing an assessment of a pregnant client who is at 28 weeks of gestation. The nurse measures the fundal height in centimeters and notes that the fundal height is 30 centimeters. How would the nurse interpret this finding? 1. The client is measuring large for gestational age. 2. The client is measuring small for gestational age. 3. The client is measuring normal for gestational age. 4. More evidence is needed to determine size for gestational age. Explanation. Question 16. Rationale. During the second and third trimesters, weeks 18 to 30, fundal height in centimeters approximately equals the fetus's age in weeks plus or minus 2 centimeters. Therefore, if the client is at 28 weeks gestation, a fundal height of 30 centimeters would indicate that the client is measuring normal for gestational age. At 16 weeks, the fundus can be located halfway between the symphysis pubis and the umbilicus. At 20 to 22 weeks, the fundus is at the umbilicus. At 36 weeks, the fundus is at the xiphoid process. Test-taking strategy. Focus on the subject, the location of fundal height. Remember that during the second and third trimesters, weeks 18 to 30, fundal height in centimeters approximately equals the fetus's age in weeks plus or minus 2 centimeters. Question 17. The nurse is performing an assessment on a client who suspects being pregnant and is checking the client for probable signs of pregnancy. The nurse would assess for which probable signs of pregnancy. Select all that apply. 1. Allotment. 2. Chadwick's sign. 3. Uterine enlargement. 4. Positive pregnancy test. 5. Fetal heart rate detected by a non-electronic device. 6. Outline of fetus via radiography or ultrasonography. Explanation. Question 17. Rationale. The probable signs of pregnancy include uterine enlargement, Hagar's sign, compressibility and softening of the lower uterine segment that occurs at about week 6, Goodell's sign, softening of the cervix that occurs at the beginning of the second month, Chadwick's sign, violet coloration of the mucous membranes of the cervix, vagina, and vulva that occurs at about week 4, allotment, rebounding of the fetus against the examiner's fingers on palpation, Braxton Hicks contractions, and a positive pregnancy test for the presence of human chorionic gonadotropin. Positive signs of pregnancy include fetal heart rate detected by electronic device, Doppler transducer, at 10 to 12 weeks and by non-electronic device, fetoscope, at 20 weeks of gestation, active fetal movements palpable by the examiner, and an outline of the fetus by radiography or ultrasonography. Test-taking strategy, focusing on the subject, probable signs of pregnancy, will assist in answering this question. Remember that detection of the fetal heart rate. Question 18. A pregnant client is seen for a regular prenatal visit and tells the nurse about experiencing irregular contractions. The nurse determines that the client is experiencing Braxton Hicks contractions. On the basis of this finding, which nursing action is appropriate? 1. Instruct the client to maintain bed rest for the remainder of the pregnancy. 2. Inform the client that these contractions are common and may occur throughout the pregnancy. 3. Call the maternity unit and inform them that the client will be admitted in a preterm labor condition. 4. Contact the primary health care provider. Explanation. Question 18. Rationale. Braxton Hicks contractions are irregular, painless contractions that may occur intermittently throughout pregnancy. Because Braxton Hicks contractions may occur and are normal in some pregnant individuals during pregnancy, there is no reason to notify the primary healthcare provider. This client is not in preterm labor, therefore, the client does not need to be placed on bed rest or be admitted to the hospital to be monitored. Test-taking strategy. Options 1 and 4 are comparable or alike and can be eliminated first. From the remaining options, knowing that Braxton Hicks contractions are common and normal and can occur throughout pregnancy will assist in directing you to the correct option. Question 19. A client arrives at the clinic for the first prenatal assessment. The client tells the nurse that the first day of the last normal menstrual period was October 19, 2023. Using Nagel's rule, which expected date of delivery would the nurse plan to document in the client's chart? 1. July 12, 2024. 2. July 26, 2024. 3. August 12, 2024. 4. August 26, 2024. Rationale. Accurate use of Nagel's rule requires that the pregnant individual have a regular 28-day menstrual cycle. Subtract 3 months and add 7 days to the first day of the last menstrual period, and then add 1 year to that date if necessary. First day of the last menstrual period, October 19, 2023. Subtract 3 months, July 19, 2023. Add 7 days, July 26, 2023. Add 1 year, July 26, 2024. Test-taking strategy. Focus on the subject and use knowledge regarding Nagel's rule to answer this question. This rule requires addition and subtraction, so read all options carefully, noting the dates and years in the options, before selecting an answer. Question 20. The nurse is collecting data during an admission assessment of a client who is pregnant with twins. The client has a healthy 5-year-old child who was delivered at 38 weeks and tells the nurse that there is no history of any type of abortion or fetal demise. Using GTPAL, what would the nurse document in the client's chart? 1. G equals 3, T equals 2, P equals 0, A equals 0, L equals 1. 2. G equals 2, T equals 1, P equals 0, A equals 0, L equals 1. 3. G equals 1, T equals 1, P equals 1, A equals 0, L equals 1. 4. G equals 2, T equals 0, P equals 0, A equals 0, L equals 1. Explanation question 20. Rationale. Pregnancy outcomes can be described with the acronym GTPAL. G is gravidity, the number of pregnancies. T is term births, the number born at term, longer than 37 weeks. P is preterm births, the number born before 37 weeks of gestation. A is abortions or miscarriages, the number of abortions or miscarriages included in gravida if before 20 weeks of gestation, included in parity, number of births if past 20 weeks of gestation, and L is the number of current living children. A person who is pregnant with twins and has a child has a gravida of 2. Because the child was delivered at 38 weeks, the number of term births is 1, and the number of preterm births is 0. The number of abortions is 0, and the number of living children is 1. Test-taking strategy. Focus on the subject of the question. Recalling the meaning of the acronym GTPAL and focusing on the information in the question will direct you to the correct option.